Bob Herbert's OpEd.tv is made possible in part by the CUNY TV Foundation with the support of Ann Ulnick. Hi, I'm Bob Herbert. Welcome to OpEd.tv. Learning that you are HIV positive is no longer a death sentence for most people in the United States. But the progress against HIV-AIDS has largely bypassed one group of Americans, gay and bisexual men who are black. Why has this happened? And why haven't we heard more about it? My guest has written a powerful cover story for the New York Times Sunday magazine titled America's Hidden HIV Epidemic. She's Linda Villarosa, an assistant professor here at CUNY and director of the journalism program at City College. Ms. Villarosa, how are you?
Good, thank you.
Thank you for coming in. I appreciate it. Let's start with the headline. Why don't you describe for us this hidden epidemic?
Well, even though AIDS is basically over, at least, that's the assumption, down mainly in the South among black, gay, and bisexual men, it's still a huge problem. And a study came out in 2016 that said if current trends continue, 1 in every 2, which means half, of all black gay men in the United States will be HIV infected.
Whoa. When you think about it, I mean, that's such a horrible statistic, 50%.
Yeah.
But this country's been fighting the scourge of AIDS at least since the 1980s. It's been a long, very difficult struggle, ultimately largely successful. Why has this group of men been left out?
Well, it's interesting. You said left out, and how I think of it is left behind. So even when advances came, whether it was political action, got drugs to be, pushed for drugs, which was in 1996, the HIV, they called it the cocktail, protease inhibitors came out and really saved many people's lives. Many black gay men were not living in places where they could access the medication, and especially in the South, where there's so much bad infrastructure, and there's just not the kind of facilities that we have here in, say, New York. These guys were left behind, and it just kept piling up and continuing, and so there just became a lot of HIV in their community, and it's now it's stubbornly there.
So talk a little bit about these fellows who were in the South, going back, I don't know how many years, but what's sort of their environment like? What are their social lives like? And in terms of health, like what kind of facilities are available to them?
Well, I'm going to take, for example, the man on the cover, Jamarius Buckley, and he was just very generous with his time with me. But, he has a hard life. He grew up in the Delta, which is in the Delta, Mississippi, is the poorest corner of the poorest state. And so there was a ton of stigma about being a gay man. And so it was very hard for him. He took a lot of abuse. He didn't want to go to church anymore because he felt like the preacher was preaching directly to him. And then he ended up with HIV, and he didn't know who to talk to, where to turn. There weren't the kind of facilities that we have here. And so he was basically a few years ago dying, and people shouldn't really be dying here in the United States. So he met Cedric Sturdivant, who is a health outreach worker and healthcare worker in Jackson, Mississippi, and Cedric helped him to get medication and to get the treatment. But it was really hard for him, and he's a quiet guy. He's on disability. Life is hard for him, but he likes to go out on the weekends. And I went to the club with him, and he dresses really nice, wears a little red pumps, wear green contacts, and likes to dance and hang out, and that's his pleasure.
The gay and bisexual men who are in that community, let's say the folks that he would know or meet at that club, do they talk openly or knowledgeably about the health aspects and give advice, or do they know where to turn for good advice?
Well, I think because I spent so much time in Jackson, Mississippi, I saw that there are good facilities. There's an LGBT clinic. There's a publicly funded STD HIV clinic. And so that's very, very good. And so that's kind of rare. So it was interesting because I started seeing that many of the men that I met, their social life was around the HIV clinic because there were other gay and bisexual men. And so he does have some place to turn, but not every community, especially the more rural you go, the less kind of healthcare, the less kind of LGBT acceptance at all that you'll find.
So you talked a little bit about the stigma. So there's still, I mean, there's always been this general stigma that surrounds homosexuality in this country, but there's also pretty strong stigma in the black community. Both in the general population, but also in many of the black churches, many of the congregations. Talk about some of the consequences of the stigma that comes from this prejudice against gays.
Well, what's really interesting is there's sort of an assumption in the U.S. that black people are really homophobic, that the black community is more homophobic than other ethnicities. And I don't exactly think it's true. I think it's complicated. I think for us as black, gay, and lesbian people, it's very hard to come out. It's very hard. It's sort of a don't ask, don't tell in many ways, because it becomes so hard to come out because the only people in a racist society that you have to protect you are your family. So you're really afraid to come out to your family and your community. So because we're not talking about this so much, it ends up looking like this terrible homophobia. But I think actually the black community is very loving and accepting once it's talked about and everybody knows what's going on. So that's setting the stage. But in the South, if no one is talking about it, then nobody knows that who's gay, who's not, who has HIV, who doesn't. Then it becomes this kind of silence. And silence is so deadly, really. And so many of the men I met didn't tell anybody that they were gay and then didn't tell anyone they were positive. So they didn't get the kind of help and support that they really do need.
Your article focused on these communities, these African-American communities in the South, but that terrible statistic that if trends continue the way they are now, half of all black gay men will become HIV positive. So that includes the entire population of black gay men in this country. So the folks who are not in the South or in rural areas, who are in big cities or metropolitan areas, do you have a sense of what's going on there in terms of access to health facilities and treatment?
Things are definitely better than they used to be. It was interesting because I visited the gay men's health crisis. So the gay men's health crisis is, it used to be mostly white gay men organization founded back in the day. And I went there and it was mostly people of color.
Is that right?
Yes, I was very fascinated, and I realized, they don't live. It's it's in the village, and so they don't live here. They're coming from Harlem, or they're coming from the Bronx, or they're coming from Queens, or wherever, to come to this facility, which is so good that it exists. But again, it's not in their exact community, and so it makes it harder for, whether we're talking about Oakland or Newark or Chicago, in these pockets of black communities, it's harder because often the facility isn't in your neighborhood.
The reason I express surprise is because I covered it so many years ago, way back when I was at the Daily News, and it was almost probably exclusively white at the time that I was covering it. So we've talked about homophobia, and we've talked about the differences between the metropolitan areas and rural areas and other aspects of the South. To what extent has race played a role? To what extent has race been a handicap or a major factor when you're talking about AIDS and black, gay, and bisexual men?
Besides the homophobia in the black community part, also in the gay community, in the larger gay community, it's very segregated. And so when, in 1996, when people basically almost rose from the dead. They call it, the Lazarus Syndrome. It's when gay men who were really, really ill, mainly gay men, really, really ill, got their medication. But in black communities, unless you were kind kind of integrated into the larger gay community, which was mostly white, you may have missed out on getting the medication. You may have missed out on finding out it existed, or you couldn't afford it. And so, you know, rightly so, gay men who had been under siege, were dying, took care of themselves and their own. And so if the communities were segregated, black gay men got left behind.
So in speaking about medication, one of the things you wrote about in your article is this medication that seems almost like a miracle drug to me. It's called Truvada. Well, first explain what that is and how it works.
So Truvada is a pill that's taken, and it's taken in a way called PrEP, which is pre-exposure prophylaxis. So if you know, to explain it really simply, it's kind of like birth control for preventing HIV. So you take it so that even if you have unprotected sex, you will not get infected. And so it really is a miracle drug, but it's also an often expensive drug. And sometimes it's covered by insurance, sometimes it's not. And so if it's covered, then you're set. But if it's not, you're in trouble.
Right. So you wrote that this is one of the treatments, one of a number or a series of treatments that has not been made readily available to black gay men. Why is that?
It's expensive. They don't know about it. It's not available in, again, places in the South where you don't have the same kinds of facilities. You don't have access to the medication. Many doctors don't know about it. Unless they're really dedicated to HIV, medical providers might not know about that. And so many black gay men don't have access to it. And I think the statistic is 85% of all PrEP users are white.
So here's a question out of left field. So you're a journalist and you're the director of this journalism program at City College. Why haven't the media made more of something like an advance like the Truvada medication? It would seem to me that should be an enormous story.
I've seen a little bit of coverage, but mostly in the LGBT press. I think part of it is it's stigmatized because I don't even know how to explain it, but people who are using PrEP, the assumption is it's like, oh, this gives them carte blanche to have sex unprotected, which is not true. It's a medication, it's a life-saving drug. But I think I've certainly seen some coverage that says, oh, you have to be careful with PrEP because it's just a way for gay men to go back to this, same kind of wild behavior that they had pre-AIDS. I don't agree with that, but I've certainly seen that talked about.
So it actually, almost in an unconscious way, helps shape the coverage of an advance like this.
The other thing that's very interesting around medication is even more direct is treatment as prevention. So if you are HIV positive and you are completely treating your infection, you have gotten your viral load down to undetectable, you can't pass the virus. So that works on two ways. It keeps you healthy and also protects you from passing the virus. And so that is actually, even sort of more direct. It doesn't have any judgment on it, the same kind of judgment. But black gay men, if you're outside of treatment, you can't take advantage of that. So you both are ill and you can pass along the virus.
This is sort of like along the lines of the homophobia. If you take conservative views or religious views or ideological views, in many cases they have stood in the way of efforts to fight HIV and AIDS. I'm thinking in terms of not getting behind the use of condoms or even fighting it and things along those lines.
That's right.
Can you talk a little bit about the effect that has had over the years in the efforts to get rid of this scourge?
It just halts the conversation. So if you can't talk about sexuality, safer sex, protecting yourself, then young people can't learn that. What struck me when I was in Jackson, Mississippi, is how many of the men I met were quite young. They were infected in high school, or they were infected just after high school. Probably most of them were. And then I looked into what they did about sex education there. They have abstinence only or abstinence plus. Abstinence plus is like one tiny step away from abstinence only. And you can't talk about, you have to give condom failure rates, you have to give birth control failure rates. It's very strange. It's a strange conversation. I'm very interested in how sex ed is taught there because it seems super indirect.
I mean, it's almost like the idea that if you don't talk about it, sex is going to be something that doesn't exist, and then we're not going to have any of the problems associated with it. It's pretty bizarre.
That's right.
So that would affect, for example, use of condoms, knowledge about how to protect yourself, needle exchange programs, I would assume.
That's right.
But do you think this has gotten better? I don't know, just randomly over, let's say, the past decade or so. Do you think that's gotten better?
I do think it's gotten better. I saw, when I was reporting around this in the 90s, I went to a conference. It was an AIDS conference. And so, I'm sitting there at a demonstration of safer sex, and I look over and I'm like, there's a lot of older black women in the audience. Who are these women? And so I said to one of them, may I ask how you got here? And she said, well, I'm the first lady. And I'm thinking, okay, of what? Is your husband a mayor or the president? And it turned out she was the first lady of a church. And so they had seen so many HIV-positive people in the church coming for help and coming for ministry that women from the church were starting to come to HIV conferences so they could learn. That was one of the happiest days of my life, having grown up in the black church myself. It's like to see people really trying to help each other and to open up and talk about this, though it's difficult and feels like it's against the church. But it is the right thing to help the people in your ministry to save their lives.
So we have a new administration in Washington, and to say the least, it's a turn from the Obama administration. And healthcare has been in the news. Do we have an indication yet on what any of the policies or the proposals of the Trump era, the kind of effect they might have on this fight against HIV and AIDS?
Well, the two things that have already happened are, one, the White House had an Office of National AIDS Policy. I think that's ONAP is what it was called. And that was scrubbed off of the White House page. So when you go to that page, it's gone. And so you have to go someplace else to find the National AIDS Strategy. And that happened right after the inauguration. And then the second thing is in President Trump's budget proposal, there's quite a significant cut to AIDS education, care, and treatment. And so right there, that's without anything happening to the Affordable Care Act. And before ACA, I guess it was like 2011, there were 9,000 people on a waiting list to get AIDS drugs. And so there were people who couldn't afford the medication. And this was the height of it. And most of them were black and brown men in the South. So as soon as the Affordable Care Act, thank you, was passed, that went away. There was no more waiting list. So now the fear is if messing with the Affordable Care Act will put people right back on the waiting lists. And what struck me was when I asked in Mississippi, when I was reporting all this news about what's going to happen with the Affordable Care Act was happening. And I remember Dr. Gibson, who is the head of My Brother's Keeper, one of the best of the organizations in Jackson, said to me, well, it won't matter here. It's just that the rest of the country will look like Mississippi.
Because Mississippi does not have...
They did not expand Medicaid.
So let's talk about Medicaid. I mean, one of the things that's virtually guaranteed is if the administration gets a bill passed and the president signs it, it's going to devastate Medicaid.
That's right.
Otherwise, there's almost no point to their legislation.
Yeah.
So talk about the effect that would have on not just the population you're talking about, but just the fight against HIV and AIDS in general.
That's right. So what will happen is any tinkering in a negative way with the Affordable Care Act will take away health care from people who are buying it. People who benefited from the Medicaid expansion will be now in trouble. Right. And anyone, using Medicaid. So that will put them on Ryan White. So Ryan White is the payer of last resort. So if Ryan White is already, there's a lot of people on Ryan White, and most of them are people of color. And so when more people get on that and have to go to this payer of last resort, there will be people who don't have medication.
Explain what Ryan White is.
Ryan White was a boy, I guess it was in the 80s,
It was a while ago.
I think he got HIV from a blood transfusion. And so the act that allowed people to get free care and treatment is named after him. So Ryan White is just where you go if you have no other way to be treated for HIV.
How did you get onto this story?
I got onto it after I saw the report that 1 in 2 African-American gay and bisexual men will have HIV, and I thought, what? How could that must be a mistake? And so I started looking into it, and I thought, oh, that's terrible. I'm surprised. And then the next thing was a few months later, there was a study that said the areas of the country with the highest HIV rates, the cities, 21 of 28 are located in the South. And Jackson, Mississippi is the absolute worst. Almost 40% of gay men are infected with HIV in Jackson. And so I was like, okay, wait a minute. Why is this still happening in a time when there is medication and there's PrEP, there's Truvada, and why is it in the South? That, we're used to it in New York and San Francisco. And so I decided I must find out. And I've covered HIV and AIDS since the 80s. And I've covered it, I was still cover 80s when it was gay men and people.
When it was a death sentence.
When it was a death sentence.
Yeah.
And then I was covering it in the 2000s when it was really intensively focused on black women. And so I was kind of winding down off of this, thinking, I need a new topic. And then I saw this 1 and 2, and I became really both upset, intrigued, and angry.
Talk a little bit about your background. How did you come to be a journalist?
I was always liked to write. I'm one of those people, probably like you, who writing comes easily. And, I'm never going to be like a Toni Morrison, but I can sit down and bang something out. And then I just loved journalism. My mother was trained as a psychotherapist, so she asked a lot of questions, and I learned to ask a lot of questions. And so she said, "You're a very curious person. You ask a lot of questions, and you can write. What kind of career could you be in?" And then we realized, oh, journalism, that's what you do.
It's funny when you talk about some of this stuff coming easily. I often tell people, some folks can shoot baskets, some guys can hit baseball, I can look at sports as a career or whatever. I could write like newspaper paragraphs. I mean, I don't know what kind of talent that is, but that's what dragged me into the business.
And I think you have to be a good listener, as you know.
I agree.
Yeah.
You run the journalism program at City College.
Yes.
Can you talk a little bit about that? We got about a minute and a half left. What are you guys trying to do up there?
Well, what we're doing is training young people in any age, because I've had all kinds of students, because it's CUNY, just to be curious, to be news literate, to understand how to, research something and where to go and what are good sources. And also use the city as a lab, because we're so fortunate to be in New York City. So you can,
so many stories here.
So many stories. And I can we're in Harlem, so I send the kids out into Harlem and just go report on things you care about. And they are quite good. And now I'm, had to switch to much more multimedia, which is fine with me. I like it. We use our phones if we don't have any camera or we don't have anything else. We're using our phones and recording people and creating stories and websites and doing everything digitally. And it's fun and really rewarding.
And are the students excited about it?
They are so excited about it. So I've been there 6 years. I had 30, journalism is a minor at City College. I had 30, and now I have 100.
Whoa.
Because we are real, I bring a lot of enthusiasm to the table because I love journalism. I love what I do.
And I think in this era that we're in now, I think reporting is more important now than at any time in my lifetime. I mean,
I agree. Really, and I have to really tell the students this is no ordinary time.
They don't realize
They don't realize it.
No, right now, folks are living through history, and young people are living through this history, and they're going to see the consequences and what results from this history.
That's right.
And it's profound.
I had to spend so much time. This is what fake news actually is, but this is what fake news isn't. And you have to report things and find the truth and use good sources, and I drilled down, and it was in real time.
Well, Linda Villarosa, thank you so much. I really appreciate it.
Thank you.
We'll be back in a moment with a final word. American soldiers, incredibly, are still being killed and wounded in Afghanistan. These casualties get very little attention in this era in which every idiotic tweet by the president is viewed as the most important and most compelling news of the day. Most Americans know very little about what is going on in Afghanistan and care even less. Children who were in kindergarten when we invaded Afghanistan in October 2001 are graduating from college this year. That's how long we've been there. If you ask anyone why we're still there, you will not get a coherent answer. Basically, for political reasons, presidents do not want to pull the plug on our wretched, mindless involvement. So what if a few troops get shot up or blown up every now and then? That's seen in political circles as much better than a president enduring the humiliation of having lost a war. Donald Trump has so little interest in Afghanistan that he has turned all the decision-making over to the generals and to Defense Secretary Jim Mattis, a former general himself. We know what generals always want when they're fighting a war: more troops. So, 4,000 more U.S. soldiers are being sent into this pointless conflict, and the Pentagon is considering sending still more. Some will die, and we will call them heroes. But the truth is that they will have died for no good reason. Their deaths will not just be tragic, but absurd. That's all for now. See you next time.